of the reasons I rank St. Joe's is when I was interviewing, I just had an excellent experience with the residents and the faculty. They told me that there was no other opportunity like this to be amongst top-notch clinical faculty and to get a broad-based clinical education.
The depth and the breadth of our training here I think is excellent. We rotate mostly at St. Joe's, but we also go out to outlying community hospitals to get a more rural general surgery experience.
We have residents rotate on thoracic surgery service, any number of general surgery services, the colorectal service. They get a lot of time in the ICU. There's a trauma service. So there's, and all of these services are busy, with lots of patients and a lot of operative experience.
We also get to go to the University of Michigan for transplant and pediatric surgery.
The resident-run clinic is something I think unique to our program. It is designed to provide the first, second, and third-year residents a little more autonomy in seeing and managing patients. The clinic is run by an emeritus general surgeon.
As a junior resident, you spend 1 day a week in that clinic with him, seeing patients and then operating on those patients.
There are a lot of additional bonuses that don't really get talked about. For example, we get plenty of funding to have loops, which are glasses for being able to perform operations in magnification. We have an iPad that's given to us to help us study and learn our material. We have a food stipend that is plenty and more than enough for whenever we're in the hospital on a daily basis.
Another strength of the training program here are the facilities that the health system provides. It's a large tertiary care hospital with 2 patient towers that are only a couple of years old, so the facilities are brand new. The operating room is about 5 years old. It's very modern. There are 18 rooms that are utilized to their capacity.
The technology here at St. Joe's is actually pretty advanced. We have several surgeons who operate with the Da Vinci robot, and we have a program in place where we do online training and then Da Vinci module training so that we can get experience with the robot.
Anything from cardiac surgery to urology to general surgery to colorectal. So the residents are exposed to robotic surgery as a new technology.
We have a simulation center with laparoscopic trainers, endoscopic trainers, the really creepy sim men where you can practice traumas and running codes.
And once in the operating room, we have attendings who are very willing and eager to help.
We get exposed to top-notch technology and we get to incorporate that into our future practice.
Obviously a bit biased, but I think our faculty are superb. I've been here almost 6 years. I rotated here as a resident, and a number of the faculty that taught me as a resident are still here.
Our attendings work here because they are invested in teaching residents, and it's what they enjoy doing.
Our education here is second to none in terms of being able to get the exposure that we need with the appropriate expertise from the excellent faculty that we have.
Ann Arbor is probably the best big small town I've ever been to. With the university, there are tons of things to do in Ann Arbor. There's fantastic food from all different parts of the world. There's great theater, there's shows.
The arts, sports, museums.
There is a wide variety of athletic and outdoor adventures, ranging from rock climbing to kayaking to running. It's
a multicultural city, which I find attractive.
There's a ton of people who come across from all over the country to be here for their education, and it's a neat dynamic, neat community to be part of.
So if you're looking at a general surgery program and you're asking yourself why would I look at St. Joe's, I would tell you that it offers broad-based clinical experience with high-quality faculty, high-quality residents.
A very collegial and professional work environment with colleagues that are nice and great to work with.
A very warm and supportive atmosphere.
We're all there for each other, which sounds like a small thing, but when you spend the majority of your life for 5 years with these people, it makes a huge difference.
And of course there's Ann Arbor, a great city to train in, a great city to socialize in and spend the spare time that you have.
We come out graduates who are clinically competent and able to go into private practice directly if we chose to, Or if we wanted to pursue a fellowship, that option is also available to us. So in reality, St. Joe's offers so much and more for general surgery education, and I would choose it again if I had the chance.